Welcome to another conversation in People in Fundraising. This podcast features interviews with nonprofit professionals who discuss their career journeys, lessons learned, and enthusiasm for working in fundraising. And here's your host, the founder of People in Fundraising, Tim Wilson.
Hello, and thank you to all of our listeners for joining us today for another one of our podcast series interviews, People in Fundraising. And today I am thrilled to welcome Danielle Marzelli, who is a major gift officer for the Salt Lake City-based Intermountain Healthcare Foundation, to our podcast. Danielle and I worked for several years together at Intermountain Healthcare Foundation, and I really appreciate her time today and what she will share with us. As a reminder to our listeners, you can find Danielle's full interview on our website, www.peopleinfundraising.com, as well as the other podcast interviews we have done with people in the field. This series is designed to share insights from people who have worked in the philanthropic sector, what they've learned during their tenure, perhaps how they have moved up the ranks in one particular sector of our industry, or maybe they have jumped to different positions during their time. As they look back at the beginning of their career, what are some lessons that they wished they had learned at that time that would be helpful going forward, where they see themselves in the future, and just any other experiences that have helped them as a professional and as a person. So with that, Danielle, thank you again so much for joining us today. Take it away and please introduce yourself to our listeners.
Thanks, Tim. Hi, everybody. I'm really thrilled to be here and totally honored to be invited. I think I would have loved to have access to a series like this when I was a baby fundraiser and also kind of fresh out of college or even in college. So I'm thrilled that you're shining a light on what is, in my opinion, a very dynamic, fun, and cool profession. So I'm really excited to be here. And, you know, I've had a number of different roles in fundraising, from back office to now kind of more of the frontline fundraising. And it sort of all started through my work. I'd done some program management before. So I actually came from the programmatic side and up through kind of the operations side of fundraising. And then have been starting to, I guess it's been a year now since I've been a major gift officer, but it still feels like I'm kind of dipping my toe in this side of fundraising. So it's given me a really, thus far, well-rounded look at our profession, and I'm happy to talk about it today.
Awesome, thank you. Yeah, I'd love to dive in with what you just said there a little bit about the programmatic component of, you know, the beginning of your career, and just for our audience, if you could describe, you know, some of what that programming background looked like. I know because I worked with you, and if you can talk about the I'm In campaign, other programming components like that, that might be very helpful to let us know how you went from that side of philanthropy to the major gift side, please.
Yeah, it's a great question. And I think that I've been thinking about how to answer this in a way that's going to be relevant. And one thing is, I kind of want to rewind back to almost when I was in college. And I went to a liberal arts school. I went to Ithaca College in upstate New York, or Western New York. And I was a sociology major, which I loved. I loved being a sociology major. And it's definitely one of those majors that, you know, there's very few careers that you kind of like get on a certificate that you are now prepared to be a master's degree student, right? Like to continue in school and maybe be a social worker, but more school. So it wasn't, but what I loved about it is I'm really drawn towards social justice and really drawn towards causes, and kind of finding, and I think this is a journey I'll continue on my whole life, but finding where I can be useful to my community, to my world, where I can kind of do my part to heal the world, and sort of, and what causes really speak to me. So I think that I went into school and have really followed that kind of homing device throughout my career. So it has not been a linear progression in any way. And that's good, because I'm not a linear thinker. So it really fits my personality. But it's really been, at this point in my life, what is going to bring me joy, what is going to further a mission or cause that I am passionate about, and then what skill set can I bring to this situation. So I think a lot of times, and for good reason, I don't mean to knock this, but I think a lot of times we're counseled in the model of sort of, dare I say, capitalism, but it's really like, what is your skill set? And then how can you lead skill first? It's a skill-based thing first. And for me, it's always been a passion-based is how I found my way. So I promise I'm getting to the answer
great.
to your question. One funny anecdote though is I always kind of knew, my career started at a reproductive health clinic in Boulder, Colorado. So I was really driven by helping further the needle on kind of healthcare in general, but especially reproductive health for underserved communities. And so I got a job there, and I was a medical assistant. And I was super excited because this was going to be my first experience in healthcare, and I'm really passionate about it. And here's how I can be helpful. And maybe I'll be a doctor someday. And I passed out on my first day.
Oh
yeah.
No.
I don't even think I was with the patient. I think they're like, here's the lab where we process it. I just hit the floor. So right then I knew that did not have the skill set, but I still wanted to be in healthcare. So fortunately, the clinic I worked with promptly moved me to the front desk where I greeted people and ushered them to their appointments rather than having to touch any needles. So
yeah, well, good to get that out of the way quickly.
yeah, it was a really quick learning curve there. But that was really where I had that was my first formidable job, first career job, really. And where I realized that there was so much more that went into healthcare, right? That it wasn't just the frontline healthcare providers, because all of a sudden I felt left out. But then I got into health education and then in program development. Specifically in this position, it was for bringing sexual health and reproductive health care to young folks and education. So I taught sexual health education in public health schools, taught public health in the school system. And then we had a clinic, especially for services for young folks. So it was really looking at how young people tend to be an underserved population, right? Because they're not full-fledged adults under the eyes of our laws. And often they're sort of censored and controlled in what information they have access to. So this was really, and information, as as we all know, is critical to functioning in our society and in our bodies. So I really wanted to make sure that people were getting that information. So that was just a spectacularly fun job. And then as I kind of grew in that position, I think a lot of people do, but in smaller nonprofits, if you're on the programming side and you get into any type of management role, you're also responsible for funding your program. So I kind of had it all at a very young age. I was like, I don't know who gave me that much responsibility. I thank them, but wow, it's a risk. So I had a staff, I ran a clinic, and I ran an education program and had to fund it all. And that was mostly through kind of grant rating.
Okay.
And that was kind of a little, for me, like a more painful part of fundraising, because it felt like, I don't know, I was like writing this grant to some powers that be that I never got to meet, never got to talk to, and they just read my application. And that's by design, right? They want to see, that's how a lot of foundations, how a lot of corporations run their programs. And I completely understand why. For me, I'm a connector and I want to build relationships. I want to talk to people. And so that felt really alienating. So I was like, well, I'm never going into fundraising. That's terrible.
And did anyone guide you in the grant application process, or were you learning, literally, as you were writing along?
That's a really great question. I had an amazing mentor, Blair, and she, I kind of like followed in her footsteps. So she hired me into the education role, and then she moved into the fundraising role, and I moved into that director position. So the way that it worked out is she was able to mentor me and taught me how to write grants and taught me how to get to know people at the foundation level. And I had some of my most formative fundraising experiences in that job, because there's the amazing grant that I collaborated on with my partners and that we were awarded, and then there was the extremely painful grant that I wrote and had a horrible conversation with the foundation. So like I really had the extremes there, which was So, and she mentored me through all of that, which is great. And she let me do that, right? She let me succeed and she also let me fail.
Yeah.
Which was
those are both valuable lessons.
absolutely.
Yeah. And so was this in Colorado or was this?
Yeah.
Okay.
So that was still in Colorado. And so then my family situation moved me to Salt Lake. And I got a position as a program manager at the Utah Pride Center, which is actually, it's for the state of Utah. It's located in Salt Lake City. It's the LGBTQ community center. And so I was again kind of doing youth programming and other sort of specialty community programming, and found my way into healthcare programming. We were not a healthcare provider, but it was right when the Affordable Care Act was happening. So we provided patient navigators and really tried to help kind of close the gap on some of the public health disparities. Like most notably, I worked on a tobacco prevention grant for young people. So that was like a really big part of it, or a breast health and breast cancer awareness campaign for LGBTQ folks with breasts. So that was like a good, so that was sort of where I got that niched in the healthcare bit. And then similar to the clinic I had been working at, it was a fundraise for your own program. So fundraise for your staff positions, fundraise to keep the lights on, like very high stakes fundraising.
Yes.
I, again, appreciate having gone through that, but gosh, you just remember in those situations, you remember every grant that you don't get and every funder that says no, because it means that, you might not be able to fund your staff, which is a hard way to go.
Oh, sure. And I remember when we were working together, you had mentioned, in addition to your core responsibilities at the Pride Center, that there were times where you may have been the only one on staff who was the point person for an LGBTQ individual who was suddenly not welcomed in their home, and you had to find, a friendly space for them for the night, or for however long it was. So definitely like going to a much more personal level beyond the writing of the grants and such.
Absolutely. And it was really, and I think, because you'd just be the only person on, like, we'd have to staff, like we'd just take shifts staffing after hours. So it would be whenever folks came in during those shifts, or if I built relationships with folks in the program, they would come to me as a trusted adult. And so I found myself navigating the sort of social services field and trying to find, like you said, a place for somebody, a safe place for, a transgender identifying youth to land for the night, and, wanting to do that in a way that wasn't just like calling up the tree of people that could offer a couch, which is a thing. But as an employee of the community center, I had to go through the systems. So it was definitely a crash course in navigating social systems, which, as we all know, are extremely difficult to navigate.
Yeah.
So again, like kind of going back to what I was originally saying about that cause-driven career path, one of the things that I realized by working at the Pride Center is the complete lack of services that were available. Like we were this community center and we were trying to be everything to everybody. So we were pulling together. I mean, we put on the Pride Festival, which was this massive community event in the state of Utah. And it was amazing and fun and took a full-time staff to do. But we were also a youth center, and we also were a mental health center. And people came to us and said, where can I find a doctor that's going to treat me like a human being, right? Like, where can I find a safe place to go? And so my kind of homing device was like, well, notice that there's this big gap in the provision of LGBTQ affirmative healthcare. Just like, and I just remember, one of my employees, who's just an amazing person, they came to me and they were like, they broke their wrist or something like that. And they're like, and they went to the pediatrician and just got the runaround about their gender identity. They're like, can you put a cast on? Can you just like not talk about that? Like, yes. So it was, so that kind of hole kind of opened up, and anyway, I'm gonna go off on a tangent, but that is what led me to Intermountain Healthcare, because I got a call from the folks in Southern Utah in St. George, and they were saying, they're like, we want to bring in a speaker on transgender healthcare. Can you set us up with somebody? So I was able to go down there and bring I did a little presentation myself, but then brought an expert in who could provide resources to the physicians down there, who are really just there's nothing for us, but we want to serve the community with the highest quality care that we can. And we don't know how to do that. And so that really put Intermountain Healthcare on my radar as like, this is a company that is going in the right direction. Like they're trying to figure it out. And at that time, Intermountain wasn't doing it necessarily from a system level, but individual physicians were raising their hand and saying like, we got to treat patients in the way they want to be treated and the way they deserve to be treated. And that is not a lot of care providers. That's not their mentality. So that's kind of what struck me about Intermountain. I knew something was special about that organization.
Okay, that's great.
Yeah. And then there was an opportunity opened up in the foundation. And I was like, well, I've got some fundraising chops. Like, let's see how this goes. So again, it was kind of that cause first sort of skill set second.
Oh, that's terrific. And then that cause focus has been threaded through all of your positions to date.
Yeah. So the position that I got hired into, was a real the foundation was consolidating. And so it was a real back office position because it was basically our operations officer. She said she's just needed a right-hand person to help her write job descriptions, develop policies, find out what floor we're all going to sit at. Like it was a real logistics kind of built program, but it gave me this amazing crash course in fundraising in a big shop.
Yeah.
Because again, I came from my experience had been, okay, like you turn the lights on every morning in the building, you make the coffee, you meet with your employees, you write a grant, you go to a support group, and it was really, and you go on the community and do education, like it was sort of everything. And I was a little tired, I was wanting a new opportunity. And so I was all of a sudden thrown into just like the logistics that come with working in like a large matrix organization, and a foundation that can solely focus on fundraising. And that was like totally mind blowing to me, totally new.
Oh, I'm sure.
Because I just had no experience in that. And it was that, and I remember always saying, and saying this to my executive directors, like, if we want to raise more money, we need to put more resources into our development department, and you can't rely on me to write grants. You can't just be splitting it, but that's a tall order when you can't see it, right?
Sure.
Like to say, you got to spend money to make money. Like that's really hard, especially when you're in a small nonprofit and you're, again, like, people bring their own pens in because our pen budget was tapped out really early in the year, and you want to put your money towards providing care, right? So
absolutely.
So then coming to a place where they were like, oh no, we'll pay for your salary, like we'll pay for you all to do fundraising, and here's some great resources, and you guys can do it. It was just like, this is a real thing.
If you could, I'd like to dive into that a bit more. If you could just share a little bit about what it was like for you, professionally, personally, to go from institutions, that were focused on causes and that, but they didn't have the resources, whether it's people or funding or the pens, to then going to a place where not like quite embarrassment of riches, but much more staffed up, and certainly you could see the trajectory of them staffing up more in the future as well. What was that like? Because you now lived in both worlds very, very early in your career.
It's a great question, and I think there's so many ways to kind of slice it and look at it and analyze it. And I love doing that. So let me bring you in.
Sure.
I mean, one of the things that, again, like is always a first and foremost in my mind is, how am I making a difference and using whatever time I have to make a difference? And that can feel really different from going from seeing clients, right? Like you said, like being at the front desk when people coming in crises, or being in front of a classroom and, talking to kids, like that's real, like service delivery, right? You can kind of see the impact, to really being like 10 spaces removed from patient care or from community work, right? So it took me a little while to reconcile with that until I really began to understand more about the impact of Intermountain Healthcare on a grander scale and what they were trying to do, and the work that now I get to be a part of, and, was able to be a part of for the past 8 years is move the needle in a really significant way. And that's just, I just felt myself drawn to that one-on-one was really nourishing and important part of my career. And who knows, I might get back there again, one-on-one with clients, but it was more that other people were really good at that, but I could kind of think about the other, I was good at the other stuff. Like I was good at back office stuff. I was good at talking to community members and talking to funders. And so now I got to do that for an organization that could really fix some of the broken policies and thus support and further buoy up the smaller nonprofits. Because that's one of the things that Intermountain does that is truly amazing to me, and I'm very proud of to be affiliated with them, is that they're not coming in and bulldozing any community work, but rather saying, we have resources and we can help you. We have resources and we can work together because you're the community experts. So rather than us hire a whole new, like, we're not going to build a Pride Center, right? Because we don't need to, because we have a Pride Center that we can partner with, and we can be the healthcare experts and talk to the community members about how we can be a better service. So so that really kind of shifted it for me. So I was like, okay, I'm in the right place in terms of the provision of service and the causes that I care about, because I'm with this ethical organization that's able to really, again, make systemic change, which is really is what's going to tackle oppression, right? That's we need both. We need all of it, but this was the part that I was really drawn to. So that has nothing to do with fundraising. So
that's all right.
Listeners, sorry.
But you've touched on causes and you've touched on relationships, and those are both critical pieces to philanthropy as well. So
yeah. Well, kind of as I'm talking, I'm realizing that now that I'm in a major gift position, I'm circling back a little bit, because while my clientele is not people we are serving from a healthcare standpoint, and now I get to be face to face with people that are wanting to connect. So they have that same feeling that I have, right? Like donors want to give back because for various reasons, but a lot of times they're just like hearing that call and they're feeling that cause, and they're saying, how can I be of service with my finite philanthropic resources? Like, how can I best be involved? And I get to be that conduit. And it's kind of while I am not a major donor, it's a kind of a language and a way of living in the world that makes sense to me, right? Because it's sort of, again, that homing device of, this is the cause I want to be connected to. And I feel very lucky that I get to sort of help them along that path, along that journey, right?
Yeah, that's beautifully said. Thank you.
Yeah. I just kind of realized that now in this conversation. So full circle.
Well, this is recorded, so you can file that away and refer to it in the future.
Yeah.
Terrific. So Danielle, you've talked about in the various roles, client facing, now facing major gift prospects, donors that are aware of the cause, they want to be involved. My question for you is, how would you describe what you do to people that don't fit in either one of those groupings? They're not clients, they're not donors or prospects. These are people that for example, if you had a room full of strangers or relatives, how would you describe to them what you do and why you do this?
Gosh, it's such a good question. And I've been having a struggle with it recently, to be honest, because I have moved back to Colorado. So I'm remote working right now. And so I see a lot. So as I meet new people, they're kind of like, oh, what do you do remote? And I'm like, oh, well, I raise money for children. And I've noticed that people's attention spans, as soon as I say raise money, it's like, like they don't except for the people who are donors. Like I remember I was notably talking to a friend of mine, to his folks, like his parents. Okay. And I mentioned it and they like latched on and started talking to me. And then I soon realized that they were, relatively large donors to the Jewish Community Center, and, were interested in kind of my job because they interfaced with development directors, right? They interfaced with gift officers. So they kind of knew what to listen for, and everyone else, I don't want to discount all these people, but the general feeling I get when I say that I raise money, it's like they just, I don't know if you have experienced that, but it's a really interesting thing. So I'm trying to kind of figure out a way to get around it to kind of engage people more. But a lot of it is I'll say like, oh, I work for a nonprofit health system that's, we're really trying to build the nation's model for children's healthcare. And we're really trying to change healthcare for everyone. And our particular focus right now is on pediatric healthcare. So the way that I help is I connect donors, so people that want to be a part of this cause and that are also passionate about children's healthcare and making sure that every child has access to quality care and every child can be healthy regardless of where they live or what family they're born into, what language they speak, their abilities. Like we want all those kids to get that healthcare. And so what I get to do is I get to connect people to make that happen.
Yeah, that's awesome. I remember when I was at Intermountain, there was a big emphasis on the social determinants of health.
Mhm.
And what you're talking about here is we have to realize what those factors, those determinants are, and how do we marshal the resources so that everyone has the same equitable access to healthcare.
Mhm. Exactly. And that's something that our CEO will say. So Dr. Mark Harrison, he'll talk about that a lot, like keeping people out of the hospital. He's like, we're never going to go out of business because there's always going to be accidents. There's always going to be disease, but we can really reduce our business, right? If people can see us when they're healthy and not when they're sick, and that type of, and again, that value-based healthcare. And with kids, that's, especially compelling because what it does is it helps us. The goal is to build a generation of wellness. It's to kind of redefine wellness and health, right? And have that grow throughout the generations. It's sort of interrupting healthcare at the level where we can make the most impact. And, that's something that a lot of donors really want to be on board with because it is the best investment is investing in kids. Anyway, so to your question, I'm working on my elevator speech. So let me know what works for you. Raising money is not something I should lead with. Shockingly, not really what people want to hear.
Yeah, well, and it's tricky. And I in my current role, my manager's manager shared with a bunch of people on a recent webinar that, and she's been in the industry for, more years than you and I have been, and she's very seasoned and very smart. And so I was surprised to hear this, and I felt for her because she shared in this webinar that her primary care physician at some point in the past, asked this woman, "Oh, what do you do for a living?" And so my manager's response was, "I raise money, and this is why I do it, and this is who I do it for, and this is why I'm passionate about it." In subsequent visits with this doctor, he or she said, "Oh, you're just, pilfering out of people's pockets." And so my manager's manager said, "That was it. I switched doctors. Like, if that's your attitude to what I do professionally, that's insulting. I wouldn't insult you. I wouldn't call into question your qualifications." So that, there's, as you've talked about, and this anecdote too, like there's definitely, hesitancies to engage on the topic of money, critiques about, why people are raising money for causes. So yeah, just how can we as professionals in this field, positively direct the conversation to people that either don't know or have assumptions that are, frankly, incorrect. So
yeah, and I think, and I think about that a lot because not just because of those experiences, and I feel, what a smart move for your manager's managers to say, "See you later," because as you and I both know, philanthropy can be really healing, and it can be not just in times of change and strife that it can give us some semblance of control and power, feeling of control power situation, but also like when it comes to being in the hospital and being able to give back to your hospital or give back to your child's hospital or physician or healthcare, like that can complete a healing journey that's a shame. I hope that physician learns differently. But I also think that, you're right, how do we as professionals kind of come out the gate and say, this is a really amazing part of our society. Like this isn't something that we want to like just reserve for people with means. This isn't something that we want to just ask for you, like, oh, if you just have a second, could you just round up at the cash? Like, and I think roundup campaigns are great, but the true giving, true like philanthropy that you're not guilted into, it can be life-changing, can be this habit that it can be a generational habit. Like it can be really beautiful. And I wish if I could wave a wand, I think that healthcare in general could do has a lot of opportunity to tell that story of philanthropy, because Intermountain Healthcare was founded on philanthropy. It was a gift.
Yeah.
The health system was a gift from the LDS Church to the community. Like that's not nothing. Like that's a really big deal. Like that's not just like out of duty, right? Like.
Well, and to your point, that was a very generous foundational moment. And Intermountain very recently, as an entity, is merging with like-minded institutions that it's how do we instill charity in our care, in our work, whether you are a fundraiser or a physician, whether you're greeting people as they come in, just making it much less transactional and more about like we care about you as a person.
Yeah.
And that's a beautiful gift.
And to expand on that a little bit, like not just this idea of charity being kind of like a top down, right? Being this like, well, I have this little extra that I will now bestow upon you because instead of, buying a new car, I'm going to, that, I mean, it's what really is it's people saying, I want to be a part of this mission, and I want to do that in the most effective way possible. And I've got this other job here. I've got this, or I'm retired, or I don't have time to volunteer, or whatever it is. And these are the means that I have to contribute. And this is how I want to do my part to heal the world. And I think that's the story that I would love to hear highlighted a lot more, because I think that would mean that, wouldn't it be great if we could all walk into not-for-profits and not see a struggling organization that relies on people's, leftovers, but rather these for what they are, which is these vibrant organizations that say we're putting people over profits, and that's why we need these partners, and we are privileged to have these partners on our journey, because we can't do it alone. We don't want to do it alone, so we've got this like great support. And I feel like that story is really could be told in a much more public way. But
sure. And we all have a role in that. It doesn't fall top down, doesn't fall on one person, the CEO or the marketing team. Like we all have a role to play with that. So thank you for that. So my last question, I know that you're relatively recently in Colorado, moving from Utah. You've been in your current role as major gift officer for a little while and hopefully getting settled. And I know you're hitting the ground running. As you look to the rest of this year and perhaps in the next year, what do you hope for yourself as a professional? As certainly the relocation settles and you're working and engaging with prospects and donors that have major gift capacity and inclination?
Yeah, it's a really great question, and I can kind of like answer part of it, right? So I think part of it is what Intermountain's doing is to me and sort of not just my feelings, but evidence-based. And our aspirations are to make a real difference, not just in the Intermountain West, but to really kind of change the fate, challenge people, and set the example of changing how healthcare works in our country and beyond. And we're already doing that in some aspects on the adult level, and we're starting to do that on the pediatric level and beyond. And I think that's kind of the niche that I'm currently in right now with my role, is that I'm talking to a lot of companies and a lot of people who are out of state, and sort of telling the story about, while this particular initiative may never hit your child or your neighbor's child, here's how it's going to benefit, your child in the future. Here's how it's going to benefit future generations. So it is really telling that story in the way of like, this is how we're going to deliver on a much on a much bigger scale than just in our communities, but while also servicing our communities. And so that's
fascinating.
Yeah. So that's been really interesting to kind of hone that message, and then to see people respond to it. Like,
Yeah.
I had one donor who was in New York and was basically like, I tend to not give outside of my communities, and I wish that the Intermountain will just come to New York, because I know if Dr. Harrison says you're going to do something, you're going to do it. And
awesome.
if you're going to change the nation's model for pediatric healthcare, when I have kids, I want them to benefit from that, even in New York City. So it really is like, it's people are having a lot of faith in our organization. And so being able to tell that on a national scale is really interesting to me. And so I want to kind of hone that and expand that. That would be wonderful. I think that would be really fun. And then I think personally, outside of work, I've sat on some boards. And so I just cycled off. I was on a board in Salt Lake, and I just cycled off that before I moved. And so I think that's a way that I'll be able to tie into the local community, is by finding, hopefully sitting on a board here, if there's, as I start to sort of network and see who's doing the type of work that I want to support and spend my time on. I have 2 little kids, so I don't have a lot of time, but sometime. And I do think it really I think that it really helps to sit on a board. It also helps my work to just kind of understand that volunteer leadership role of it.
That's great. Yes.
Yeah.
I wish you the best in settling in. I can see there's snow on the trees outside your window, and
yep.
So
it was -4 out this morning, so we're
wow.
I think we're up to like 8 degrees right now. So
okay. But yeah, I just really delighted to reconnect with you, Danielle, and I appreciate your time. On the topic of generosity, you've been very generous with your time, sharing your insights, why cause-based philanthropy and causes in general have helped to guide your career path to this point. And I just wish you the best as you look to hone the verbal, the written communication to prospects, in your new community, and certainly in your work, what the importance is with philanthropy and how it can benefit people directly, indirectly, and the role that you have that's so important to bridging the need with the people that have the resources, and not just people, but the entities, corporations, companies, and such. So well
Thanks,
said.
Tim.
Thank you so much, Danielle.
Well, thanks for inviting me, and I'm excited to follow this podcast moving forward. So thanks for including me in it.
My pleasure. Thank you. And thank you all to our listeners. I'm sure that there are important, helpful, and interesting takeaways from Danielle's conversation with us, the time that she spent with us. As a reminder, you can find Danielle's interview as well as others on our website, www.peopleinfundraising.com. So signing off for this round. Thank you very much.
Thanks, Dan. Thanks, everyone.
Thank you.